Okay, welcome everyone. Welcome, welcome, welcome. Thank you so much for joining the Diana Wright Show live online. Welcome you from around the world and in the United States. My special guest this evening is Dr. Melanie. Oh my goodness, Dr. Melanie is having issues with the camera, but anyway, we're gonna, I lost her. All right, I don't know where she went, but I lost her. So we're gonna wait until she gets back and see if we can actually get her live with us here. Pavial. Okay, all right, I'm having issues. I don't know what she did. We just spent a lot of time trying to fix it, and then she is disappeared. So we will just kind of go through a few things here, reminding you that this is the program of love, the program of I Love Me, and you know, the program that just teaches you about love and ask you to be loving yourself every single day when you wake up, and also to remind you of April 30th, and that's the date that you will be celebrating yourself. Lots of action going on in the studio tonight. So we're gonna have to just be a little patient and bear with us as we get it sorted out. We talked a little bit this morning about loneliness, and we, you know, I thought about this story all day today and wonder how many lonely people are actually out there and just dying of loneliness, because loneliness can actually kill you. Okay, so I'm not so sure how many of you are, but we're going to talk a little bit about. Okay, did you know that there are 5 million zero TV watchers? Yeah, 5 million households are actually not watching any television. So we are going to have to ask Dr. Melanie to call us on the phone, because I don't think she's handling the Skype very well. So call her for me, please, and I'm going to turn this off. Okay, so there you go. We are just wow. Okay. Just want to run through some stories here, and there's Dr. Oz is giving us some secrets of living well. Living well. Yes, he's giving us the secrets to do that. So we're gonna ask you to do this in the morning. I'm not so sure if when I wake up in the morning I am able to do all of these things. Dr. Oz wants me to stretch. Okay, Dr. Melanie, is this you?
Yes, ma'am.
Okay, all right. Dr. Melanie is on the phone. So we're going to go to her, and then we'll come back to the other stories later on. And welcome to the program again. I'm sorry we didn't have the Skype thing worked out, but because it was working out quite well. But you need to get whomever twisted your phone, you need to untwist it so we can get a full shot of you. Okay. All right. Whoever that person is, I'd like to conk them right now. But anyway, all right. Let's start out by talking about autoimmune diseases, because it seems to me that a lot of people, black women especially, from Toni Braxton to a few people that I know personally, are having autoimmune diseases like lupus. What can you tell us about lupus and how to recognize that you actually have lupus?
Well, lupus is one of those, although rare, that's a popular disease that's being diagnosed actually a lot more now than previously.
Oh.
It is so interesting because there's people who have been affected by this disease. For example, Toni Braxton, and are basically carriers of the disease state and not knowing this for extended periods of time until symptoms become quite overwhelming. This particular disease is one where you have inflammatory processes that occur with swelling and damage to the joints, the skin, the kidneys, the blood, the heart, and the lungs.
Okay, because I remember her saying on her show that her lupus loves her heart and her lungs.
Yeah.
So, and I guess it attacks different people, different organs are attacked. I have a cousin that actually died of from lupus.
Right.
So
the inflammation of the heart is what's known as pericarditis.
Mm-hmm.
Then the inflammation of the lung is what's known as pleuritis. So the pleura is basically that protective coat of the lung.
Mm-hmm.
And so an inflammation of anything is really called an itis.
Right.
And so what happens is the immune system makes up proteins, and these proteins are what are known as antibodies.
Right.
Everybody has antibodies in order to protect and fight against antigens,
Mm-hmm.
which are, either your bacteria or your viruses. And so with autoimmune disease states in general, the body is unable to distinguish or differentiate between antigens and healthy tissue.
Mm-hmm.
And so because of this process occurring, then, it results in the swelling, the pain, the tissue damage. And basically an antigen is any substance that's capable of producing an immune response.
Okay, is lupus something that you're born with? You have that gene in you or something? Or how does that work?
Well, there's some people who actually have a predisposition, if you will, to this particular disease state. Obviously family inherited type of situation.
Mm-hmm.
But there are drug-induced states of lupus as well. So there's certain medications
Mm-hmm.
that can actually lead to a lupus-like state. But the problem is, depending on what your, cause of this particular disease state is,
Mm-hmm.
it doesn't matter, because at the end point, it's a flare-up or, periods where patients become incapacitated for whatever, their process manifests as
Okay.
at that particular time.
Right.
And there's something that they call a butterfly rash that, some people develop, and that's how a lot of people will know that they actually have lupus at the end of the day when they go and get tested.
Wow.
So in the area, minus your nasal bridge, in the area where your cheeks are, kind of where you have rouge,
Mm-hmm.
people will develop this intense rash, and, for some reason they'll think, well, maybe they got sunburned, but it's not really that they really got sunburned. It's just what the disease process is doing to their body. So when they're out in the sun, it's even more exacerbated at that time.
Okay. All right. I'm not quite sure, because everyone, I remember my cousin, she just got really skinny, and her hair became like Indian hair.
Mm-hmm.
Her features changed, and it's like, okay, what's up with this thing? So you're kind of lost. And then with Toni Braxton, she looks the same way, but she gets attacked from her heart, as she said. According to her, lupus loves her heart, so I guess it's just different people, different gene pool, and it affects different people. I was working with another young lady. She was fine, doing well, Heather, at the radio station, and all of a sudden she just died. Boom. And I know another person that had it from she was a kid, and if you see her, you'd never know that she has anything like that. And I have another friend who lived until she was in her 60s and then died from it.
Well, here's the funny thing. African American women in general suffer more severe symptoms, and the mortality rate or the death rate is actually higher.
Okay.
And about 1.5 to 2 million Americans have some form of lupus, so it's pretty prevalent.
Really? In the U.S.?
Yes, and 9 times more likely for a female to be diagnosed than a man would be.
Wow. Okay. Wow. I want to attack another one called rheumatoid arthritis, because you see them advertising it on television, all this medication for it, and some kids are just really suffering with this thing. How are those? How do you recognize that one?
So with both, well, pretty much, let me just back up and say, with any type of autoimmune disorder, blood test is how you diagnose these conditions. Obviously, patients' symptoms that they present with is going to be a telltale sign, depending on what their complaints are. But then their family history, of course, kind of gives you a shoot-in, if you will, towards where to go as far as your workup would be. Mm-hmm. But in some cases, you might have a suspicion and you do a blood test and it's negative. Mm-hmm. So, it doesn't always present the way that you typically would. And if medicine in general, every patient presented the same way, it would not be very exciting.
Right.
So with regards to rheumatoid arthritis, that's also a blood test, but you have to look for what they call the rheumatoid factor. Mm-hmm. So normally, when you suspect that a patient has an autoimmune disease, you would do a blood test known as an ANA, so that's anti-nuclear antibody. And mm-hmm. if that is positive, which it can be false positive in many cases, mm-hmm. then you go into more specific testing depending on what the patient presents with and what your suspicions are. So in the case of something like rheumatoid arthritis, you would test for the rheumatoid factor. Mm-hmm. And if that comes out positive and the patient has deformity of their joints, they call it like a swan neck deformity. Mm-hmm. So many times you'll notice on a patient's fingers, or their joints in general, they will have what they call many times rheumatoid nodules. Mm-hmm. So you'll see that there's deformity of the bones of their joints because of the inflammatory process that's taking place. And in addition to that, they're not able always to flex their fingers the way that most people, in a normal state, would actually be able to flex their finger. In addition to that, they usually suffer with pretty significant pain symptoms as well. Okay. But not only that, there are some cases where some people develop juvenile rheumatoid arthritis. So you can have children present with rheumatic arthritic kind of pain that's pretty severe. I mean, I don't know if you've ever, come across anyone.
Well, I've seen Tony Braxton's sister Tracy has a son who has rheumatoid arthritis, and they actually brought him on the show, and he has it really bad. You could actually just see it, that he does have it. So I just wondered, and I read up about it, and it's something like they can grow it out. Some kids do. Boys tend to more grow it out than girls, based on the research that I saw online. So I'm not quite sure, because, sometimes online is not necessarily accurate. But that's what I discovered.
Just to kind of top that off, but in many cases, if you just want to give an idea of rheumatoid, it's a chronic inflammation of the joint, and other areas of the body can be affected. And the thing is, it is not favorable to any particular age group. So anybody can be affected by this particular disease state. And not only that, it's a chronic type of disease. So in many cases, patients are on, different, they call them inflammatory modulators, and also steroids in order to reduce the inflammation that's taking place, to kind of alleviate their symptoms.
Like prednisone.
Yes, which comes with its own side effects with chronic disease.
Yes. It has its own problems. And that's one of the things that really puzzles me with all these medications. They help you in one way and they kill you in another way. So what's the point? Seriously. When you listen to all these ads on television and they tell you how many things it can do, and then they go, here's a list of things that you have to be thinking about. Boom, 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 boom. And you go, do I need to take that or what? So I don't know. I think it's just scary.
It is very scary. And, unfortunately, science is a beautiful thing. However, in many cases, there's some questions that still remain unanswered with many of these autoimmune disease processes. Mm-hmm. And creating a drug to fix one problem, oftentimes with chronic use, results in another problem. Mm-hmm. And, it's kind of like, a catch-22 kind of a situation, because on one hand, you want the patient to be able to function as normal as possible, but then in many states, they become very dependent on a particular medication in order to relieve their symptoms, and just to help them not become depressed, because in many cases, even with Toni Braxton, as she shared on various talk shows, it can become so debilitating that these people go into chronic depression.
Yeah. I kind of wonder, what's the difference between say, an autoimmune disease like lupus and, say, RA, as opposed to sickle cell? How, I know it's a vast difference, but can you just kind of give people an idea of how different those two diseases are? They both seem to be affecting a whole lot of people all of a sudden. I just don't get it.
Sickle cell, the difference is with a sickle cell, it actually is a change in the normal biconcave shape of the red blood cell. So the way the red blood cell would be nice and round, instead it's kind of a half moon shape. And what happens when the bone pain or joint pain occurs with this particular disease state is that as that cell tries to pass through the blood vessels, it gets stuck, causes inflammation of that particular area, and that's how these patients suffer with chronic disease, bone pain. And also they go into crisis because also with sickle cell patients, if they're dehydrated, they can have a severe sickle cell crisis. If they have any type of infection, let's say a pneumonia or bronchitis, they can have a pretty significant amount of sickle cell crisis-related bone pain that's associated with that. In addition, if they go to certain heights, so altitude also affects them. Weather changes, cold weather also affects them. So their symptoms are a little bit different in that sense, where with rheumatic disease, most patients will tell you they feel a lot of pain early in the morning, and then as the day kind of progresses, in some cases their pain symptoms, are relatively moderate compared to what it was when they first woke up in the morning.
Okay.
And then in the case where lupus and rheumatoid arthritis, just like sickle cell, can affect really any part of the body.
Right. Okay. All right. Our special. Go ahead.
It's of your body not recognizing those antigens that it should, and it reacts. So the basic story is that the body is attacking itself.
Yes, I hear that term all the time. The body is attacking itself. Oh my goodness. What do you do? Anyway, and they give you all this cocktail of medication. And then I remember a girlfriend of mine whose daughter had RA when she was younger. And, it's maybe about, 30 odd years ago. She said, the doctor said, just go home and take some aspirin.
Wow.
As opposed to now, where you're taking all this cocktail of stuff of, prednisone and some of the names you can't even pronounce them. And seriously, she ended up with just, like one of her foot kind of turned a little bit, but that's about it. Really, so I'm wondering if the aspirin doesn't work better than all these other cocktails that they're actually giving you. Anyway, our special guest inside the Diana Wright Show live this evening is Dr. Melanie, affectionately called Dr. Melanie, and she is a general practitioner, a rare breed in the medical field these days, so that's why we like to have her on, because we can ask her anything and she can answer it. She can't say, this is not my specialty. All right, I want to talk a little bit about fibroids, because it seems to me that, and by the way, before I even get to fibroids, is there anything that anyone who's suffering from rheumatoid arthritis or lupus can actually do with their diet to kind of change things around? Or diet really doesn't help this kind of stuff?
So, to be honest with you, if you're on steroids for treatment of any of these two conditions, steroids in general open your appetite. So in many cases, a lot of these people are going to eat whatever they feel like. One of the things I would say is moderation of salt intake is very important, because in many cases, people with rheumatoid disease as well as lupus tend to have swelling. They're at risk of increased swelling in their joints, and just in general, swelling of the body, and so monitoring your salt intake is very important, because water follows salt, and if you have a high salt content in your body, then chances are you're going to have a lot of edema as well. Okay,
so it's best for us all, not just those with high blood pressure, to keep away from salt.
Right.
Yes, okay. All right, let's move on now to fibroids, because fibroids seem to be attacking young girls, older women, middle-aged women. It doesn't seem to have any specific kind of type or something. What is causing all of this? Is it the food we're eating, or is it just our bodies that are generally, made to be that way? Because not all of us have fibroids.
Right. Well, it's funny. Certain kinds of chemicals that people consume in their food. So, unfortunately, a lot of our food is engineered. And these particular foods that we consume, unbeknownst to us in many cases, have particular chemicals in them that can stimulate fibroids. So, things has a high estrogen content, and in many cases, blood products have high estrogen levels. Then, a lot of people will tend to consume these kinds of products. So anything that's going to increase a stimulation of the fibroid, which is a benign tumor that basically can grow anywhere in the uterine cavity. It could be inside the uterus, it could be outside the uterus. But as long as a patient consumes a food that has a high estrogen content, people do fatty foods. And they don't really think too much of it, because sometimes they'll say, oh, I just fry my food once in a while, it's not all the time that I do that. But that, in itself can also cause women to be at risk of having fibroid disease. And of course, the most common case is a family history.
Oh. Whoa, okay. Family history, fibroids, okay. So there are certain things that actually feed the growth of the fibroid in your belly.
Correct, because there are many women who have been pregnant, unbeknownst to them, they had no idea they had fibroids, and when an ultrasound is done, the fibroid is competing with that baby that's trying to grow inside their body.
Right.
And so in some cases, some patients have had to have surgery to remove those fibroids to make sure that their pregnancy remains viable.
Okay. How dangerous is having fibroids? Is it something that you must get rid of? Or is it something that you kind of just say, okay, let it stay there. If it's not growing, then, we don't need to do anything about it?
Well, it can become that. And I actually have a close of mine who actually experienced this, but it can grow very large because estrogen feeding into this abnormal growth in your body. And as the estrogen levels are elevated and you feed, it gets fed, then what can happen is it can actually cause obstruction of your bowels.
Oh, okay. So it can be dangerous then.
You can have obstruction of your bowels, and it can also push up on your diaphragm because it's growing, and now it's almost like pregnancy. And so they can develop shortness of breath and other, pretty serious problems if they're not removed in many cases.
Okay, is there anything that women should be kind of looking out for when it comes to the signs to say, yes, I need to go to my gynecologist and check this out because I think I might have fibroids? Are there any, signs? So
besides the fact that you might have a family history, very heavy bleeding during menses is in many cases a telltale sign. It's not always the case. But in many cases, patients that come in with what we call menorrhagia, or heavy bleeding, during their period. So let's say every hour you soak through a long super kind of pad, or let's say you're wearing a tampon and you're wearing a pad and that's completely soaked. And I mean, you go through this for 7 days straight. That's a pretty significant amount of blood loss that you're having, which puts them at risk of anemia.
Right.
But pretty significant, heavy, periods during your menstrual cycle, and also many times abdominal pain or noticing abnormal abdominal growth when you're not pregnant, could be telltale signs.
Is there an age factor to this? Because I know young women in their 30s who tell me they're filled with fibroids. And I know people who are over 50 who have fibroids. So is there a normal age thing to this, or it is kind of just random?
In many cases, when fibroids are discovered, many people are in their mid-20s and upwards in age.
Wow. Okay. Didn't know it would be that soon. 20s. Okay. So
There's some rare cases, not always, but there's some rare cases.
Okay. All right. Our special guest inside the Diana Wright Show live, Dr. Melanie, and she's here with us, and we are talking about lots of things that affect women. We'll get to the men in a minute because I saw a very interesting story today about the size of the male organ called the penis. Okay, so, and you know, who has the biggest number and which country is having the most surgeries. I didn't even know that you had penis surgery to make you, you get online and you see some stuff when you're trying to prepare for these shows, and it's just incredible. I have a good laugh sometimes in the daytime. Anyway, Dr. Melanie's office is West Palm Beach Family Doctors Inc., and her number is 561-434-5678. That's 561-434-5678. If you're looking for a general practitioner who can tackle just about most of your issues. So, we're going to go now to endometriosis. This is something that I think young women especially get this, and they get so down because they realize they can't have children. How on earth does this endometriosis happen, Dr. Melanie? How does it happen?
Well, this is very interesting that you actually brought this topic up, because this is a very common diagnosis.
Really?
In many cases, this is quite a common diagnosis for a lot of young to middle-aged women.
Wow.
There's actually an area in the uterus, a lining of the uterus that's called the endometrium. And that particular area is obviously where this gets this effect of endometriosis occurs. In many cases, when a patient presents to your practice, especially with pelvic pain, then you have to have this diagnosis in the front of your mind or the back of your mind, but it has to be in your mind somewhere as a practitioner, because it is one of those things where, like you said, the risk of infertility is pretty high. And in many cases, there's some people who have no symptoms. And that's the most scary part of this disease diagnosis.
Wow.
But often pelvic pain during, normal menstruation or even during the ovulatory period is oftentimes where patients would present with that. However, there's no real definitive cause per se that many people would think of with regards to what can cause this. However, the issue with regards to this particular disease state is women in their reproductive years is the most common prevalence. And, like I said, there's about over 1 million women in the United States alone that's been affected by this particular disease.
Wow.
So that's a lot of women. And like I always tell you, if this affects you, that makes it 100%. So you don't care if it's 5 out of 100, 5 out of 1 million. If it affects you, that makes it 100%. But normally around 25 to 30 years is usually when, this disease is diagnosed. But in many cases, you can have women or girls as young as 11 years old that are getting, this disease diagnosis. One of the things that we would think about many times is people who have multiple sex partners or a history of having multiple sex partners that can put them at risk. So in many cases, they'll have a history of, let's say, a chlamydial infection or, another kind of STD that puts the whole uterine cavity at risk, because in many cases, you have some people that will present with constipation, diarrhea, lower back pain, irregular or heavy menstrual bleeding, and that's the other big thing that you have to think about with regards to abnormal bleeding in a female who is sexually active.
Okay. Wow.
But there's no real definitive pinpoint cause as of yet, other than, the risk that many patients have, which is being extremely sexually active.
Okay, well, the two young women that I know that had endometriosis in Jamaica were two very young kids. I don't even think they were sexually active yet. And they found out that they had endometriosis and could not have any children. And they, in particular, one young woman, a beautiful young lady, a very good friend of mine's daughter, she just was so depressed about the whole thing that she couldn't have any children. And I kept saying to her, just not worry about the children, try to get well, And, she was having treatment for it and all that kind of stuff. I think eventually she had a baby when she got married, but the process was just horrible for her, and she just really took it to a very depressed level. So I didn't realize that it was such a prevalent disease until you just mentioned that it's quite a few cases in the U.S.
Right.
Yeah, okay. All right, I want to stay with the, female reproductive kind of thing here because I was watching the Kardashians last week, and Khloe Kardashian is unable to conceive, it seems, and then she was getting treatment because they don't think the lining in her uterus can actually hold a child. Can you explain that a little better in layman's term? Because I really didn't know that was a possibility. I know that people have miscarriages, but I wasn't sure how. But they kind of describe it like, they're giving her this medication that's supposed to make the wall of her uterus a little stronger, that it can actually hold the baby.
The progesterone is the primary hormone that thickens the uterine lining. So when you have your periods, for example, progesterone levels are extremely high because it wants you to conceive.
Okay, so it's progesterone.
Progesterone. So the body is made in such a way that your progesterone levels will go up during menses or prior to menses, let's say the ovulatory period, because the aim is that there's going to be an implantation of some sort that is going to have to be maintained. So it may be, I cannot say for sure because I am not her physician, but it may be that particular hormone level is not at its, the highest level that it could be within normal for her to be an ovulation. There's a particular drug, clomiphene, that they often give to patients who would be able to conceive. And what this does is particular hormone, progesterone, can be stimulated and the uterine lining can thicken so that it'll actually be able to contain the baby. When we have periods as women, we shed our endometrial lining. So that lining gets thickened during ovulation in preparation for a baby. When a baby, obviously is not planted, so no conception takes place, then that lining gets shed. So in her case, it's potentially, the reason why that particular lining is not as thick as it should be. And another thing is when women come in and they have irregular menses and you do blood work, look at what the hormone levels are, these particular hormones that I'm talking about, LH, luteinizing hormone, which stimulates ovulation, FSH, which stimulates the follicular formation, to eventually form what's called the corpus luteum, which is that particular egg, if you will, that particular substance that you're going to shed from your uterus as long as there's no conception that's going to take place.
Right. Okay.
When that lining of your endometrium, is extremely thickened, then many times they do an endometrial biopsy, and that will help them determine that this is why your period most likely could be abnormal. But most likely that's what's going on with her, why her lining is not as thick as it should be to be able to maintain a pregnancy.
Yeah, because initially they told her that she wasn't ovulating at all.
Right.
Which I think she just was down, depressed, shocked, everything when they told her that, because she's like, well, I'm having my period, so what do you mean? But anyway, the woes of young women and older women. Let's stay with this, in this whole scene here and ask you this. Is infertility similar to what, say, Khloe Kardashian is experiencing, or are these two different things? Totally.
So, in many cases, well, here's the thing. Infertility could be caused from many different things.
Right.
So there's cases where some people, some women have STDs that are untreated, or recurrent STDs that can lead to actual abscesses forming on their ovaries. So it's what they call a tubo-ovarian abscess. Let's say you have pelvic inflammatory disease, which can be caused by chlamydia, but there are other causes as well. Then if they develop any kind of blockage to their fallopian tubes, then they also will be considered, at risk of being infertile.
Right.
So there are multiple other reasons that have to be considered with regards to what causes infertility. And then obviously if there's no ability to ovulate, that definitely poses a problem. Similar to patients who have polycystic ovarian syndrome, where they have high levels of testosterone, but their female hormones are not where they should be, so that they're able to normally, be able to have conception the way that most women would.
Okay.
Because their ovaries are full of cysts. So.
Alrighty. Our special guest inside the Diana Wright Show tonight. We're talking about some intimate stuff that you need to know to take care of yourself. And if you do have anything that Dr. Melanie's talking about, you can actually give her a call to get some more information. Her number is 561-434-5678. That's 561-434-5678. And her practice is called West Palm Beach Family Doctors, Inc. And we're going to go back now, and I want to talk a little bit about, is it normal for women over 55 to be having their period? Is that normal?
Is it normal for them to still have a period?
Yes, to still be menstruating, as some people will say. I just say period to make it quick.
There are actually some women who do have late menopause. So, is it normal? It's a tough question to answer because only God Himself.
Okay, can answer that one. Alrighty. Okay.
So, and there's some women who experience extremely early menopause. So it's difficult to say whether or not that's considered normal. For women who would like for their period to end at age 50, or in some cases age 30, extremely early, because, obviously it comes with its own mood swings and everything else that's attached to, changing your hormone levels in preparation for menses. I would definitely say that is a question that only God Himself can answer.
Oh my goodness. So ladies who are out there who are over 55 and you're still having period, because I know a lot of you are, I don't know, there's no help for you. Only God can help. That's what Dr. Melanie says. So I think it's abnormal, because I'm serious. 55 and you're having to go put the pad and a tampon in. Oh, I don't know. Holy moly.
The risk of endometrial cancer actually is whether your periods are too short or too long. So you have early, what they call menarche, or your menses started extremely early in age, or late menopause, you're kind of in that risk zone as well for that particular thing to occur. Because, again, it's all about the hormones.
Right. That injection that they're giving to teenagers now to prevent ovarian cancer?
The HPV vaccine?
The HPV. It's caused quite a bit of problem around the country. One black woman said her daughter, had, because of taking this, she got autoimmune diseases. That was one of the things. And some people are saying their kids, one person said they got blind because they took this thing. So are you having any experience with this thing? This HPV vaccine?
I've actually given HPV vaccine to young women who obviously with consent of their parents, unless you're 18 or older,
Right.
Are considered to be have at-risk behavior. So what I mean by at-risk behavior, sexually active at an extremely early age, which puts you at a high risk for getting cervical cancer. And of course, again, not just starting at an early age, but also having multiple partners.
So young ladies, keep your panties up.
Right.
I always say to young women, do you see, seriously, I always say to them, do you see how far God put your JJ? It's all the way up there, so no one can get there unless you allow them to. And multiple partners is not a good thing. So you hear that now, cervical cancer. Why you want to even expose yourself to that? So basically what you're saying then is if you have a teenager, say a 19-year-old, 18-year-old, 20-year-old, whatever, moving out of the teens to the 20s, and they're not sexually active, should they be taking this vaccine?
Well, I have had discussions with my patients.
Okay, someone else is trying to call in. You see, that's why I wanted you to be on Skype. Okay, go ahead.
No, but the CDC has put it out there where the vaccine is recommended for preteen girls and boys at age 11 or 12 years.
So why are they trying to give it to 17-year-olds?
To be honest with you,
because they tried to give it to my daughter, and I said, absolutely not. Absolutely not.
Protecting the community at large. However, it's kind of like putting condoms in school. For many people, this is a gateway to go do what they want. And now Plan B is rarely available, so that's something else that, is...
Yeah, because that's what I was going to get to next. What do you think about the morning after pill, which is the Plan B, as you just called it? What do you think about that one?
Parents that are out there, and maybe they don't have that kind of a relationship with their children. But, a lot of parents are very open, and they say, well, I just want to protect them from, potentially having to deal with a serious medical issue in the future. And I'm thinking, that's why you're the parent, and that's why they're the child, that if you go and say, okay, I want to give my child Gardasil or Severix, which are the two vaccines that, help in prevention of cervical cancer.
Yeah, Gardasil is a popular name for the one that everybody talks about. Gardasil.
But in many cases, for a lot of teenagers, this is like, or preteens, this is an open ticket for them as far as they're concerned, because many of them will argue that, I got the shot already, so I'm good.
Well, my thing is, if you have your children under some semblance of discipline and control, and you talk to them about sex, about oral sex, about every kind of sex, about the possibilities of getting all these diseases and all of that, and you open up their mind to it, and don't tell me that, you feel, oh, I don't want to talk to them about sex. Sex is why we all got here. Okay. And I believe that parents need to come off the pot, talk to their daughters especially about all these diseases and all these preventative measures. And there is no reason for you to be having sex nowadays before you are married or actually ready to do this, because there's so many things. I mean, when I was growing up, nobody was talking about all these things. Okay, so many things. So for you to catch, and we're living in a society that's open. People are talking about homosexuality open even. I mean, so why are you not talking to your children about sex? And a young girl should not be having any sex and opening herself up to cervical cancer and getting chlamydia, gonorrhea, AIDS, the big kahuna. I mean, I just don't understand parents. I really, truly don't understand them. And I see them on television shows talking about, oh, I don't know how to approach the subject. I mean, come on. You are the parent. That's why you are called parent. So it's for me, my advice to anyone who has a teenage daughter, tell her to keep her panties on so she don't have to take no stupid Gardasil or whatever those vaccines are called. And that's simple. It's simple. Why is it that, our hormones raged when we were young and these young people just can't control themselves? What is it? What is it? Is this the food that we're eating now or what? All the engineered food.
Well, you know what? That's a part of it. But one of the big things is you have to remember technology has increased tremendously. And so what you might not sit and tell your teenager, they already know in many cases.
Truly.
It's accessible at their fingertips, and even if they're not the one necessarily searching the computer, you can have a friend who might be searching the computer and might be educating your children when you're the one as the parent that's educating your child.
Yeah, well, I like to be the first educator, and then you can get all you want from the frills. Okay. I want to move a little bit now and talk about desire, sexual desire, because there was an article last week that came out, and a lot of women got upset about it because men are so, every time you turn the television on or the radio on, you're hearing about Cialis, Viagra, and some kind of stimulator for men. And, women are saying, okay, so what about us? But basically, men do not simply understand that women go to sex based on desire. So if you're going to try to have sex with me, you have to kind of romance me a little bit. It can't be the only time you romance me is when you want to get into my panties.
Right.
Not cool. You have to, it's a process. But I think a lot of men believe that, okay, I'm ready, so you got to be ready. But the blood just flowed to his penis and ain't nothing happening in my brain. I mean, seriously, just speak to that, please. I mean, because I just think it's absolutely crazy.
Well, the question I often get from my patients is, why am I not in the mood? And the funny thing is, there's nothing worse than not being enticed by the person that's supposed to be your partner.
No libido.
You really is. And not because you don't necessarily want to be in that intimate setting, but sometimes it could be distraction. Many cases with women, we juggle so many different things. In some cases, you're a wife, you're a mother, you're a teacher, you're a friend. You know what I mean? You have so many different hats that you wear on a daily basis.
Right.
And depending on which hat you're wearing at the time when he shows up, what he desires, it may not necessarily be a good time for you, because with women, everything happens psychologically before it manifests physically, or before, the physical act takes place. Whereas with men, they're stimulated by sight. So yesterday he might have seen you in a nice dress, or, your hair might have been different, or you might have smelled a certain way. And
yes, or the cologne is not right tonight, honey. You're not wearing the right cologne, okay? Some women are turned on by cologne. So you got to learn what your partner is turned on by. Dr. Melanie, this conversation has to get real deeper next week, because I have a whole lot of questions that we didn't get to about this whole libido thing, desire thing, the fact that men are now, as a matter of fact, in Greece, did you know that in Greece they have the most penis surgery to enhance men's penis in the world? Yes.
I'm not surprised.
And the men with the largest penis are in the Republic of the Congo, 7.1 inches, as opposed to Asian men who have 3.3 inches. And they're saying that French men also have small penis, and American men are right in the middle somewhere. So we gotta get into that, seriously. Next week, I promise you, and I promise you that I'm gonna get Dr. Melanie on the Skype so we can leave the phone free, because I hear the phone buzzing since she's been on, and we're talking about all these different issues, because people are suffering in their relationships. And one of the biggest things that I wanted to talk to you about before we kind of go, because I didn't even realize the time is almost finished. Loneliness. Do you know there's an article today that loneliness is just as bad, it kills you just as bad or faster than cigarette smoking, being overweight, and all those other diseases? I was kind of shocked. So, and they're saying you don't have to be single and living alone to be lonely. You can be married and lonely. So, yes. So how do we get to that place? We have to really get into this. Because I think people are married and they're just struggling. Women are lying in their beds on their backs and their husband is snoring away, and he just kind of had some sex and he's gone to sleep, and she's there going, so what happened to me? What just happened?
This goes back to the emotion.
The desire.
whether it's a friendship, it's an intimate relationship with your partner, whoever. It really should be based on an emotional connection. And
yeah, but Dr. Melanie, when you're married for 20 years, I don't know about the emotional connection thing. I'm not so sure about that.
Well, you know, put it this way. Whatever it took to establish the relationship is exactly what it's going to take. That plus much more for it to maintain it and keep it. And so people have to be creative. And so a lot of times you have people who will say to you, well, you know, I've been married to him so long and I'm used to him doing certain things a certain way, and he'll say the same about her. And then there's a distraction because now their children, you know, their careers and everything else that goes into that mix in that pot that you have to think about. And what happens is the more busy our lives become, the more we have to learn how to compartmentalize different things and make sure we know what our priorities are at the end of the day. So you could be as busy as a bee and still accomplish nothing. And so the same goes with the relationship, where that loneliness you feel, sometimes you have to internally search yourself and say, what exactly am I looking for? Because many people can tell you they feel lonely and they have no clue what exactly it is that they need fulfilled in order for that lonely state not to exist.
But is it also true that when you have children, your libido seem to kind of disappear for women?
Well, what happens is your focus gets shifted. And so that maternal instinct kicks in, and in many cases, the last thing you're thinking about is that husband or that significant person that, you know, you made this child with.
Right.
Sometimes it's the very last thing on your mind, and your focus now shifts because now you've experienced in many cases what it feels like to have an internal relationship and an attachment because that umbilical cord connects you and that baby. And so until that, I mean, and that's why a lot of women, when they lose children, they suffer tremendously because, especially if they've experienced the baby kicking or whatever the case might be, you know, like a full-term pregnancy.
Right.
So if you look at it, that internal bond, that maternal bond, and that's why when a baby will smell its mother, it can detect who its mom is in comparison to other people, because of the internal bond that was formed.
Right.
So when people get to that place where they say, you know, they're lonely, you really have to sit down and analyze what are the things that are in your life that are causing your priorities to be shifted, that has put you in that place where you feel that emotion.
Right.
You know, of feeling disconnected in many cases, or just feeling like nobody understands who you are, the real you.
Okay. All right,
Sometimes
well,
you don't even understand the real you.
Yeah, right. Sometimes you don't even understand yourself, or you're trying to figure out, you know, why are you not responding, or is something wrong with me? You know, and I hear a lot now about, you know, you need to go and see a sex therapist. I don't need to see no sex therapist to tell me what my desire is. I think you need to tell your partner what you desire of that partner to do to you so you can get in the mood.
Right, and that goes back exactly, Diana. It goes back. Knowing yourself. Take time to know who you are, what you like, what you are about, and that can make it a lot easier. And the other big thing is communication. If there's no communication, forget about it. It's going nowhere.
Amen. Amen to that. Okay, Dr. Melanie, our special guest inside the Diana Wright Show Live. We're going to heat this up next week again. I know a lot of you, you know, you're like, Diana, I like to talk about sex too much, honey. If it wasn't for sex, I wouldn't be here and you wouldn't be here either. So we should not be shy to talk about sex. It is a fact of life. A lot of our teenagers are having sex and having babies out of wedlock, which they should not be doing. So if we open up a show like this and allow you to speak your mind about it, and young people should call and ask the doctor questions that they're kind of pondering with, it will make life much better, I think. Okay? So the pastors don't have to be worried about all them pregnant girls in their church. Seriously.
I'm excited to see that conversation next week, too, because I will say this kind of, I guess, as we're tuning from this session, but sexuality is a complex process that's coordinated by neurologic, so the mind, vascular, the blood flow, and the endocrine systems, that's the hormones that make it happen. So you have to look at all those particular factors working in conjunction together in order to get you to that place where everybody is satisfied emotionally, physically, and otherwise.
And the emotions of men too, because men, a lot of people don't understand that when men get to a certain age and they have battered themselves out when they're young and the thing ain't working that great anymore, they get emotionally distressed also. So it's not just women, you know. So we gotta really get into this next week, Dr. Melanie. And there are lots of other things that I didn't get to, like hysterectomies and, you know me, I have 1 million things on my paper to ask you, but we can only do but so much. So next week, I promise you, I'm going to make sure that Dr. Melanie gets her phone fixed, so she can go crossway on the iPad. so you'll have a full picture of her, because I'll take my face off sometimes and put her on, so you can actually see her and hear, so you can actually call on the number in the studio and ask her your own questions, because I heard the phone buzzing a lot when we were talking about certain things. So I know that you are ripe for the conversation. Okay, so tell your friends on Facebook that we are talking about love and sex every time Dr. Melanie is on. Okay, we're not going to be shy about this thing anymore, because I think that's the problem why so many teenagers are getting pregnant and having babies out of wedlock and can't take care of those children. They're children themselves. So anyway, Dr. Melanie, thank you so much, and have a good night and a good week. And we will hook up next week. And please get your phone fixed, because you got to be on screen. Okay.
Thank you for having me on.
And thank you so much for being our guest. We really, really appreciate it, and appreciate your knowledge of just about any question I throw at you. I really, really appreciate that, because a lot of, doctors, they're only into their own little specialty. And as a general practitioner, you really can touch all the bases. So I appreciate it. Thank you so much.
My pleasure. Have a good night.
You too. All right. That was Dr. Melanie, and we will have her back next Tuesday. She's our special guest inside the Diana Wright Show. And we're going to really delve into this sexual thing, because it seems to be a big issue. Who can have sex, who shouldn't be having sex, and the diseases that you'll get when you have sex, and all those other things. And I'm just going to remind you of my favorite quote as I rumble through my papers and I find it. I want you to remember this, penetrate it, and whatever it is in your relationship that's wrong, next week we'll give you a chance to come on and talk about it. So the number to write it down, 561-228-1921. That's 561-228-1921. And if you'd like to talk to Dr. Melanie and ask her any questions, you can do so. Her number is 561-434-5678. That's 561-434-5678. Her practice is called West Palm Beach Family Doctors, Inc. So you can give her a call. And we're going to talk about loneliness again next week. And we're going to talk about that survey that you heard me talking about. I'm going to do it on my morning show tomorrow. And, it's Wow Friday. So I was wowed with Dax. Tomorrow is Wellness Wednesday with Dax Dunn as he joins me here. So we kind of have a solid base. We have Tuesdays with Dr. Melanie in the evening. And we have next Tuesday morning, we're going to have Dr. Minus Ricketts. She's going to join us, and we're going to talk a lot about education and college. So all the young people, you need to tune in. And she is a lady that has great resources and great information for you. So we ask you to do that. And on a Friday morning, Dax and I will just go through the week's news and kind of, delve into all the situations. And we call it Wow Big Friday. So Wow Big Friday, those are the stories that wow me during the week. And, Dax can bring his own wows too. And the big stories of the week. Also, I'm asking you to never, 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 ever give up on your dreams, your passion, and whatever you want to pursue in life. Just give yourself some time. Get the naysayers out of kick them to the curb. Kick all the negative people out of your world and kick them to the curb, all right? So you can move forward and do the things that you really want to do. Dance like no one is watching. Love like you'll never be hurt. Sing like no one is listening. And live like it's heaven on this earth. Yes? Please do that. And remember the boxes that you need to open up every single day in the morning. It's a gold box, it's a purple box. The purple box is tied with a gold ribbon, and the gold box is tied with a purple ribbon. And I'd like for you to untie it every single day and see what gifts God is giving you in that box. You don't have to literally do it, but you can. But you can just imagine it. Your imagination is a great thing, a powerful thing for you to utilize. For you to take on a journey. The place in life that you want to be, just close your eyes and see yourself in that place. See yourself with all the things that you want. Don't be too materialistic, but we want you to be happy. Love and happiness is crucial to good health and wealth and prosperity. And loving yourself is the key to unlocking the boxes. So start there, and remember, April 30th is International I Love Me Day. Yes. And we really, really and truly want you to spread the word. Tell your friends and even your enemies. I want you to tell your family members, your spouse. Let them know that this is the program that promotes LOVE. And 3 little words, how powerful they are. I love me. So keep on thinking that this is heaven on earth. Live like it is. You're in heaven right now. So just live it. Stop complaining and blaming someone else for your problems, and stop acting like you're so busy and you ain't doing anything. Find some time to take care of yourself and nurture friendships, because good friends are hard to come by. So if you love something, set it free. If it comes back, it's yours. If it doesn't, it was never yours. This is Diana Wright saying thank you so much for joining me, and I look forward to seeing you tomorrow morning at 10:30 when I have Wednesday. It's Wednesday, yes, and that means Wellness Day with Dax Dunn. We'll talk about some other little things too, but I'll kind of get Dax on the whole penis thing tomorrow. I know he's going to think I'm crazy, but I'm going to get him involved anyway. So we're going to try to make the evening shows more talk about relationships and sex and things that's bugging you and all of that, and just call and speak your mind. If you can't get rid of a guy, I'll tell you how to get rid of him. If you are having a relationship where you feel it's going nowhere, it's dead end, you need to quit and move on. Okay? And you need to keep your panties up. And men, keep your pants on. And your penis in your pants. Okay? All right. So, take care. Tomorrow is going to be a greater day, a wellness day. And we'll also bring you some more news about different things. Thank you so much once again from around the world and in the United States for joining me this evening. We hope you had some great information. We inspired you a little bit. We made you laugh a little bit. And you might think I'm crazy by now, but I'm not crazy. I just like to be open and talk about things. Because if we talk about things, my daughter, I talk about everything with her. There's nothing you can go try to teach her that I haven't taught her already. Okay? So that's what I would like for you to do with your young women in your lives. Don't be afraid. Don't be ashamed. Sex brought us all here. So why not? Have a good evening. Stay prayed up. Keep loving God, and know that with Jesus in your life, all things are possible when you believe and you have faith and you trust Him. Ciao. Au revoir. Adios. Okay.